Respiratory Syncytial virus, RSV, is a highly contagious respiratory virus that affects young children and older adults. This video will explore various aspects of RSV, including its epidemiology, virology, pathogenesis, clinical presentation, diagnosis, treatment, prevention, long-term consequences, outbreak investigation, antigenic variation, animal models, viral evolution, and genomics. By the end of this video, you will have a comprehensive understanding of RSV. Let's begin. RSV is a widespread virus that affects people of all ages. It spreads through respiratory droplets, direct contact, and contaminated surfaces. Infants, young children, immunocompromised individuals, the elderly, and those with respiratory conditions are at higher risk. Preventive measures include hand hygiene, respiratory etiquette, environmental cleaning, surveillance programs, and vaccination campaigns. Implementing these measures helps control RSV and protect public health. RSV is a negative-sense RNA virus with a lipid envelope. It attaches to host cells, fuses with their membranes, and replicates its RNA to produce viral proteins. These proteins assemble, creating new viral particles that are released and cause further infection. Studying RSV helps in developing treatments and vaccines. RSV primarily infects respiratory epithelial cells, leading to respiratory illness. It triggers an inflammatory response, destroying the respiratory epithelium, impairing ciliary function, and increasing mucus production. This can progress to severe lower respiratory tract infection, causing bronchiolitis, pneumonia, and respiratory failure. The immune response to RSV is crucial for disease severity and protection. Innate immunity detects the virus, triggering cytokines and chemokines. Adaptive immunity involves T lymphocytes and antibodies, clearing the virus. However, the response can cause lung injury. Understanding this response is vital for developing vaccines and therapies. In infants and young children, RSV typically causes bronchiolitis with symptoms such as nasal congestion, cough, wheezing, and respiratory distress. In older children and adults, RSV resembles a common cold with symptoms like runny nose, sore throat, cough, and malaise. Prompt recognition of these clinical presentations is important for accurate diagnosis and management, especially in infants who may require hospitalization. Symptomatic treatment is usually recommended for older children and adults, with a focus on alleviating discomfort and managing complications. Increased vigilance during RSV season helps identify cases early, allowing for infection control and preventive measures. In order to identify and manage RSV infection effectively, it is crucial to diagnose it accurately and promptly. Diagnostic methods for RSV include antigen detection assays, such as rapid antigen tests, molecular techniques like PCR, and viral culture. PCR is considered the most reliable method due to its high sensitivity and specificity for detecting viral RNA. Sampling methods for diagnosing RSV include nasal swabs, nasopharyngeal swabs, nasopharyngeal aspirates, or lower respiratory tract specimens in severe cases. The choice of specimen depends on factors such as the patient's age, clinical context, and illness severity. Timely identification of RSV infection enables appropriate patient management, implementation of infection control strategies, and the initiation of pharmacological treatments, if necessary. In the treatment of respiratory syncytial virus, RSV, supportive care is prioritized, with hospitalization for severe cases. Antiviral drugs like ribavirin are limited in use. Prevention includes immunization, infection control, and public health measures, while vaccines and awareness campaigns play important roles. Recent research suggests that severe RSV infection during infancy may increase the risk of developing asthma later in life. The exact reasons for this association are not fully understood but may involve immune dysregulation, airway remodeling, and persistent inflammation. Proper follow-up care, including early identification and management of respiratory symptoms and adherence to asthma management guidelines, can help reduce the long-term impact of RSV infection on respiratory health and improve quality of life. RSV outbreaks in healthcare settings are challenging due to rapid transmission and severe disease. Investigation involves identifying cases and tracing contacts. Control measures include standard precautions, cohorting, visitor restrictions, and education of healthcare workers to limit RSV spread. RSV has different strains with varying surface proteins, making it difficult to develop vaccines. Different approaches, like live-attenuated and subunit vaccines, are being explored to enhance efficacy and protect against diverse RSV strains. Regular updates of vaccine formulations are crucial to combat antigenic variation. Animal models are important in RSV research to study how the virus causes disease and assess potential treatments. They provide valuable information about viral replication, immune responses, and vaccine effectiveness. However, results must be interpreted carefully, considering differences between animals and humans. Animal models are vital for advancing our knowledge of RSV and developing new therapies. This section on respiratory syncytial virus, RSV, discusses the variability and evolutionary patterns of RSV, which requires continuous research and surveillance. Genomic sequencing and phylogenetic analysis help identify emerging strains and inform preventive strategies and vaccine development. Understanding RSV evolution is crucial for predicting future trends, tracking transmission, and evaluating interventions. Genomics also aids in characterizing new variants and improving patient outcomes. In conclusion, respiratory syncytial virus, RSV, is a global health concern that requires ongoing research and collaboration. This script has provided a detailed understanding of RSV, empowering you to contribute to its management and prevention. Stay curious, keep learning, and contribute to efforts combating RSV worldwide.